don't just place and pray. We don't just call on the first day and on Friday to see if they showed up and then here's your bill. We're engaged both with the provider and with the healthcare worker while they're on the journey. We've reduced our attrition in these roles from our own attrition from 50% to less than 20%. There are times when it's just not a good fit, but for the most part, the people who work with us and through us, it's life-changing for them. I am the hired gun. I'm the CEO of the company. We have a CFO. We report into the board. We don't make any big decisions without consulting the board. The one throat to choke is mine. Yeah, we use it in recruiting, but we still have a human in the loop. We always do. That's the most important piece to me of AI is you have to have a human in the loop who actually knows whatever it is they're doing and can use discretion. Like lifting mental weights for your brain. You know, you want to make your body better, you go out and you lift weights and you do these things. If you want your brain, use AI to help hoist it up. You look better.
Welcome to another episode of Humans of Staffing. This is Sammy Singh, along with my co-host, TJ Sammy. Today, our guest is Milissa Ales-Barnicoat. She's the CEO of AlliedUP Coop, a healthcare worker cooperative that is redefining how talent, employers, and communities share in the value of work. Milissa, welcome to the show. Now we get into our show host and the guest mode. I know we just met you and we went through some of the things that AlliedUP is doing. I'm really excited to talk about this because this is something that's completely different as a concept that we have ever spoken to anybody about. So first thing, Milissa, welcome. Secondly, please tell us the first and foremost thing is what is a co-op? How does that work? Because in our industry, either your staffing agency or your EOR or your recruiting firm, it's typically those three. You've just added a fourth category. Please shine some light on it.
Yeah, and I could even add another, but I'll start with...
Go for it!
So we're a worker-owned cooperative, which means our workers have a voice in how we run the company, how we spend our money, how we make decisions within the organization. That means they sit on our board of directors, as well as we present our financial results to them every month. We present our strategies. We present our challenges. We share our opportunities. So it's, I guess if you think about like REI, you know, you join the cooperative, you get some discounts if you're there, and that's a nice thing. Within our organization, what you put into our cooperative, you get out. So we pay a patronage on an annual basis. That's part of our bylaws. We do an annual report. Here's what we did. Here's what we spend money on. Here's what we have left over. Here's what we pay out this year. By vote, we agree on that's the right path to go forward. So it's a little different, and we're not beholden to shareholders. So I'm also just an employee of AlliedUP, and we're not beholden to, privately held company who, somebody needs a new boat or yacht or new cabin. That's not it. We're working for our workers, and our main drive within our cooperative is for our folks to have living wages, benefits, pension, all the things that people should enjoy when they are going to work every day.
Having said that, it's a co-op. In every corporation, as at least the experience we've had, is there's somebody that's always held accountable, right? Things go wrong in corporations. There's going to be, corporate responsibility. There's going to be documents that need to be signed for banking, all of that. How does this structure work? Is there board of directors? Then it comes to a management team. Then the cooperative members. Are there these tiers of shares or responsibility that gets divvied up?
It's pretty standard. Like, I am the hired gun. I'm the CEO of the company. We have a CFO. We report into the board. So we have a fiduciary responsibility, obviously, to keep the company going. We don't make any big decisions without consulting the board. We'll all have a list of strategically, here are the things we're going to do. Here's where we're raising money from. Here's what we're doing within the organization. And we run that by the board, and they certainly can debate us on how we're going to move forward. Our bylaws dictate a lot about how we operate, how classes of worker are structured. But yeah, I mean, if the one throat to choke is mine.
Still, there's an accountability at the end of the day. Got
Always,
it.
you never
Always,
escape.
there's got to be someone that's got to take
Everybody
that.
has a boss, right?
Yes, yes, absolutely. Know that well. So,
Talking about throat to choke. So, Melissa, just be curious to really learn about your background. Like, if you could just spend a couple of minutes just walking us through your journey where you are today, just your professional background.
Sure. I mean, it's a staffing business. I've been in
Right.
staffing for 1,000 years. It seems like I started out. It was a funny journey. So early on, I was working in a completely different business, and we opened up in Ireland. And when I went to Ireland and opened the company, and I was working with, at the time, the Irish Development Agency. And I met this woman, Margaret Cox at ICE, and it was a staffing company. So she came in, she's like, I can help you staff this thing. And we got close throughout the time I was there. And I was fascinated. I'm like, what a great business. So when I came back to California, I through people I knew, I was introduced to Bernie Halroyd at Apple One. And so I went to work for Bernie, running a branch office and some trade schools that he had at the time. And the staffing business is like I don't know, it's like a hobby that you take on and you just can't get it out of you, right? I love the business. So I worked for Manpower in their global department for 10 years. I worked for Adecco. I've worked for smaller businesses, any niche you can think of. It was IT or engineering and different things, marketing, um, big players, little players. So yeah, I've just always loved staffing at its best. It's, you've been in staffing, there's all kind, like anything, it's always a little bit tough. But what I always loved about staffing is that you find people work, and work is fundamentally the most important thing you can do for human beings. It puts food on the table, it puts roofs overhead, it allows children to thrive. And so that's where my deepest meaning always has been. And when it was really hard, you would look at, but yeah, we have 1,000 people out on this account going to work, and they're providing for their families. And that just always resonates with me. So, um, you know, been there, done all of that. And then when this opportunity came up, um, like any opportunity, it was through different networking and people I knew. And it was an old boss that was working on re-envisioning the world. And she called, and it was like, yeah, I would love to be a part of that.
Yeah.
has it been difficult to communicate the concept over to the clients? Or because I would say it's such a great benefit if you could go over on the client side what the
Yes,
benefits are of using you, and then we'll go on to the candidate side and the employees slash your partner side, right? So
that's
let's
right.
look at the client side. What are the true benefits that they're getting that is over and above what other typical staffing agencies are going to be out there placing?
We go beyond the placement. So we start before placement that, you tell me you need MAs, everybody needs medical assistants. And, before you ever see somebody, we do a job readiness assessment for everybody that comes through our door. Are you ready? And the assessment's about that provider. Are you ready to take this job? Whatever if it's because there's different environments. Some community clinics are different than a rehabilitation facility, is different than a skilled nursing facility, et cetera, et cetera. So it's really an assessment of the individual before they ever get to you. For the providers, the biggest challenge they have is turnover, attrition. if you look at statistically in allied, those skill sets, allied healthcare, medical assistants, CNAs, LVNs, it's about, on average, it's about over 50% turnover in the first year. That's painful and that's
Wow.
difficult. And it affects patient care more than anything. So, with the talent incubator, we are a talent partner to those providers. We don't just place and pray. Let's hope,
Yep.
and we don't just call on the first day and on Friday to see if they showed up and then here's your bill. We're engaged both with the provider and with the healthcare worker while they're on the journey. And we provide them training. So they're going through they go through a training class called First Day, how to show up on the first day. We're plotting what bus route do you need to get on. We approach it as coaches. Are you ready to take this job? Have you figured out your childcare? Have you figured out what bus route you need to get there, what your transportation is? Can you work these hours? So we work with our healthcare workers that way. And then once they're placed, the one thing we ask of providers is to work with us. So if, as an example, TJ, I'm going to pick on you. If TJ doesn't show up on Monday, let us talk to TJ and find out what happened from a very humane perspective, where we can coach TJ then to say, TJ, this is what you have to do, and let's give people chances. And in doing that, we haven't obviously completely solved it. I'd never tell a provider like, oh, we walk on water. But we've reduced our attrition in these roles from our own attrition from 50% to less than 20%. There are times when it's just not a good fit, but for the most part, the people who work with us and through us, it's life-changing for them. And for our providers, they have a partner that is a talent partner, not just a placement agency. We go way beyond the placement.
Are there any, so you still probably have a similar type of contract that says it's an hourly bill rate, here's the markup, or here's your
Absolutely.
bill rate, right? Everything is, I'd say, pretty much in line with everything else. It's funny
Yes.
you say that, sending all that. Our entire concept of work now came from that problem. Is we created an app many years ago now, and we mainly use it for very heavily for blue collar workers, which is it tells me where I need to go. I get 4 offers of what are the different jobs I have. There's a video of the job. Then basically, as soon as I click yes, it actually guides me through traffic. How do I get, we use it today for thousands of workers. And then they're able to say, okay, this is the job. Did I like it? Did I take my breaks as necessary? Did I get the directions? I get the video again because sometimes parking may be hidden at the back of the building, not in the front.
That's
So
right.
those are typical problems that we have at least tried to solve it through technology because we just, and then at the end of the day, did you like your shift? Would you be returning tomorrow? And in the morning, we give them everything again.
Yeah.
So we've already built this into an ecosystem that exists today because when you're moving thousands of people, you don't have time to be able to check in on each one. You want to grab the exceptions that may occur.
Right.
So that intent that you're doing really makes a difference in that attrition, and it's showing in your numbers already.
Yeah.
Usually you have to coddle it through technology because of sheer numbers.
Yes.
So
And
that's
I have a new COO that came on for that particular purpose of scaling. So we realize that some of the things we do today as humans, we are looking constantly updating our technology to look for those intersections where it's a better experience. It's enabled and it's scalable.
has to be. There's
Yeah, of
just the
course.
way the future is coming in. It has to
That's
be.
right.
And you've been fortunate enough to work. Apple One was a great example. I believe, is that the same gentleman who used to show up at all these offices like early in the morning? You'd see him,
Yeah.
he'd show up, and it's a legendary. He's
Yes.
legendary at his work. Like he would be a gentleman who worked for him basically told me, he said, Sammy, I'd be showing up at whatever, 8 o'clock at my job in San Diego, which was one of my terror. And this gentleman's been there already for an hour sitting there and,
That's very
kind of going
true.
through, and you never knew when where, which store, and he did that forever, and that's why great companies are built.
Absolutely. Yeah, yeah, he was a legend. He would, and he would go in and train the branch personnel,
Yeah,
as and he had at that point, he was on his path to, he had Act One with his wife. He was on the
yes, Act One
move
was
to create,
huge.
or Agile One now.
Yes.
Um, he was on a mission to be $1 billion company, and yet he was amazing. And yeah, that's great leadership. You got to get in the weeds. It's not just sitting in a
Yes.
gilded cage and waving a wand and make it so. You got to get dirt under your fingernails.
Hence why your thought process is different than someone who's only had 100 temps to deal with or 500 temps in their lifetime, right? That's the key. We also come from running something that's 10, 12,000 temps. Your mindset has to change completely because there's
Oh,
systems, but it's a
absolutely.
people business. And what you're doing is taking care of the people at the end of the
Yes,
day. They must know that this place is different than someplace else I went.
that's right.
But are your rates pretty much in line and competitive with the rest of the industry?
Absolutely. Otherwise, we'd have no business. I mean, nobody understands I got to pay more, especially in this world.
Well said. Now let's look at the candidate side. Okay,
Yeah.
what's their motivation? They've got choices, especially if you're coming out of a school. Typically, they promise you all these things that now that I've given you $150,000 debt, I expect you to go make some money.
Yeah.
So where does that start for you, and where does that you have to germinate at some point in time to get it to grow?
Yeah.
How does your journey
So
start?
we do have a contract with Futuro. So they're graduates. We have a list of who's coming out, and so we hold a webinar to start out with. Like everybody talks about what or Futuro talks about. This is what we can do. We have little all the ways you can reach people and tell them about us, and we hold a webinar to say here's how we coach every school. So we're not different. All the trade schools have a placement coordinator who, you know, get your resume together, here's the job board, go on out. What we do a little bit differently is we do the webinar first. This is what we do. We assign a coach to you. The coaches are, we use AI within our two. Bullhorn does have AI in it for helping with the resumes, and anywhere we can, we use technology. Um, uh, in terms of communication and looking at how things are done. But then we have a human being that talks to people. And what the main job of that human being is to talk to the person about who they are, what their challenges are, and what we mainly do is build up their confidence. People coming out of school, particularly coming from different communities, they don't have the confidence to go out and get a job. And our coaches are the person that's there saying, that's okay, bad interview, go for another, go for, we're, it's not just go to the job board and post and pray. We coach them. Oh, good, you've got an interview, let's do a mock interview. And these aren't long conversations, but they're enough to help the person feel good about themselves. It's like when I'm out looking for a job and I'm working with a corporate recruiter and they prep me, you're going to talk to TJ. TJ's going to, this is who he is, and be ready for this. And after I get feedback, I give them feedback. That's what our coaches do, which is differentiated from your typical experience at a trade school.
Go ahead, TJ.
Okay. Yeah, I was gonna talk about have you talk a little bit more about your community because I think that's a huge differentiating factor as well. That we deal with several staffing agencies, and I think that's where your that glue of bringing people together and just kind of you spoke about prior to this call. You spoke about being lonely. I thought that I think both Sammy and I were like, wow, I never even thought of that. If you could please just talk about a little bit more about the community you create for these for the talent that's out there.
Yeah, this is new in 2026, so hot off the presses. We've launched our talent growth hub, and we invite everybody to join our community. And within the CUBE community, we have all of our training in there. So if they, first day, just go take the course. Um, we've invited We work with different groups, and we have a group of experienced healthcare workers um, in California, and we invite them to be peer and mentors to them. So we've created groups like the MA group, and it's a chat, it's a community. It's like going in and you can, I had a bad day, I had this happen, and you've got community members to say, I've had that same bad day. Here's how I handled it. So we have different facets within that community hub to support people, both from a coaching perspective, a training perspective, a peer perspective. Um, yeah, so that's our vision, is to have somewhere where, whether they work through us or not, whether they're out on an assignment with AlliedUP Cooperative or if they're working at Kaiser, we want them to come back to us for refresher courses, all the different things. And, we're trying to think of them as fast as we can of, what do workers need? Do they just need something on, gosh, how do um, I have to make this person's, but how do I make a bed? Because sometimes you're a home healthcare worker, you have to know how to make a bed. So every facet that you can think of, we want to create a hub where they come to us and they get value from that touch.
Which position is in demand and you can't find enough people for, that you would suggest someone to go out and get some training?
Radiology technicians.
Really? Okay,
For love
radio.
nor money, you can't get those. You can call hundreds of providers and ask them what they need, and their eyes gleam and they go, do you have radiology technicians?
Why is that the case?
I have no idea. It's expensive training. I think that's part of it. Um, and I think some of these, we can get really political, but some of them, they have these long externships that go with it, and they're not paid. So unlike the construction industry, where, you go and if you're an apprentice, you actually get paid to do the work. In healthcare, a lot of times the apprenticeship programs are like a sterile processing tech. I know that one. It's 400 hours of externship you have to do, and it's not paid. And sometimes people
Wow.
are going to school because they actually need to earn money. They can get themselves through school, but the minute they're like, I can't do another 2 years of externship or not paid. Even you go through med school, if you're on an intern, when you do your internship, you get paid. But in this field, I think that's part of the challenge. And then maybe, I don't know, maybe it's just not that sexy of a job to do radiology, though I'm a real proponent of telling everybody, go, yeah, it's a great job.
Could it be partly the stigma of radiology and nuclear and radiation and all of that?
It
That could
could
be
be.
partly because they always say, even with radiologists, that, oh gosh, that's a tough one. Don't be in the clinic, right? They'll usually be at home reading
Yeah.
everybody's charts. They don't even, the
Yeah. The
two radiologists
radiologist.
I know don't even go into the hospital. They're just sitting at home reading charts all day and making comments.
Yeah.
They might as well, that's their social media all day, you know,
Yeah. All of
read
those
things
are
and
filled.
yes, so that might be one that is there. That could be part of the reasoning behind it. And where do you see growth in all of this? Is home healthcare going to keep growing? Is it the hospitalization? Which side of, given that the funding's down, everybody's tied on medical somehow, as they're pulling the carpet underneath. Where is the growth going to be?
I think it's going to be in home health.
Okay.
It's least expensive for home health care workers. You put a RN over a CNA, that the CNAs go out for an hour, and then you have just home health care workers who um, help you with, certainly with loneliness, but they do, light housekeeping, bathe you, change you, pick up for you. Um, so I think that's what I'm seeing right now. It changes. This last year, um, we've seen sort of the less nurses, more assistants type of thing, restructuring. You only have so many dollars to spend. You got to be really um, judicious on how you spend that money, and people are going home faster. They're all of our, if any of us are ill, we're going to end up in the laps of our family, hoping and praying they can take care of us. And rural America is really suffering. The clinics are closing. So if you don't live, you live in Orange County, you've got plenty of facilities. But if you go out into the Inland Empire, you go down to El Centro, there's oftentimes you have deserts where there is no health care.
And typically in nursing homes are also, of course, growing, but home health care more so because it's cheaper to take care of someone in their homes than
That's
it
right.
is in a nursing home, right? There's a big difference in both of those. And
Absolutely.
and so, what would typically be a criteria for a worker that's going out? Transportation.
Yes.
What are the check boxes? If today I wanted to be in, because I know that's where the growth is, and I'm needed, and you have to advise someone. What are the two or three criterias that they should have? A list that they should check off that says, "Yep, I qualify for this, and I should go out and do this."
Anybody can qualify, so I'll start there. There's
Okay.
this, most states in the United States have a program where if I'm taking care of my granny, I can fill out a form that, I'm taking care of granny, and I get paid to do that. So you do have a lot of family members that will do that. So a live, warm human being who is willing to take care of someone. Um, and if you're in an agency, um, the qualifications are, if you're not administering any medication, if you're just a home worker, you have to have transportation, you have to pass a background check, and you have to have vaccines, so that you're and pass a physical test to make sure that you don't have anything you can pass on to the people you're taking care of.
TJ, I'll let you ask the next
Yeah. So in terms of now on the complexity, I can already see the complexity of hundreds of talent moving from different. I'm assuming you're providing home care health workers as well as no only providers. Is
Yeah,
it
right
strictly?
now we're working providers. We have a exploration going on right now to see
one.
if that's an avenue for us. The largest cooperative in the country is run by the SEIU 1199 in New York, and that is a 40-year-old cooperative that is home health care. So we've
Mm,
been exploring, like, oh, what's that look like? How do you do that? Um, because home health care, then you get into, there's the Medicare side that
right.
pays, and Medicare does not pay well. So there's
Yes.
some restrictions on how well you can treat the workers that are doing that. If this is
Right.
what they pay, that's gets challenging. And then there's the private, and obviously private is a whole different animal where um, patients are paying out of pocket for that service.
Just curious. I know you mentioned earlier that you've been on this job for 3 years. What is it that surprised you the most of this business model? That you, thinking of what you thought, one thing is knowing it by concept versus actually executing upon the vision. What is it that surprised you the most?
I think we'll talk to our evolution. So what surprised me the most was the attrition. That
Ah,
it harkened back to my earliest days of doing light industrial. And when I started with Manpower, it was all, and I was in I was the HP account manager. I'm here in Silicon Valley, so that was my start of that, and then we took it global and all of that. But why Manpower at that time was they had a manual dexterity test, and that was their differentiator. At the time it came out, it was Manpower has this thing to make sure that workers can actually move their fingers and do the things they need to do on a industrial line. Um, And that was about, and so that's always stuck with me. So the attrition was the biggest surprise, and it's more women in this field, and so there's all kinds of things that go with that. And so that was the evolution to how we evolved the company. Was we've got to, what is our manual dexterity test, which kind of started the thinking. And then we started thinking about, well, why are people leaving the job? What is that? um, and then I got involved with some employment social enterprises, which is the kind of other ooh-wah that we do, which is really working with people to get them their first jobs, working with really underserved community members that have experienced um, life challenges, and getting them from those life challenges into employment. Um, and that really informed a lot of what we've done also. So kind of taking that real staffing view of how do we, what's our manual dexterity, what can we, like the readiness assessment, but then what can we do beyond placement to ensure that people that get into this field stay in this field. And part of our vision for the Talent Growth Hub is to encourage them to take the next step in their career. If you're a medical assistant, what's it mean to be an LVN? What's that mean financially? What's that mean work-wise? And how do I do that? So it it really is, we wrap this also employment social enterprise mindset around our cooperative.
Well, so does that mean did the school not prepare them enough to be able to know what the challenges of the job are? Maybe there was not enough practical experience. Because, how you may go to a school, you have this vision, everybody has this, bright-eyed, like, oh my God, I'm gonna go to school.
And
This,
I'm
and
going to make
that's why most people don't
$1,000,
do what they
right?
graduated. Yes, yes. Most of us go to school thinking we're going to do a certain thing. Most people don't end up working in that and end up doing something else, unless they're specialized in something that they loved. Do you feel that is the cause? Because that's a very high attrition of them not knowing that, gosh, this is what was expected of them.
I'm not going to say anything against the schools, right? I think schools are schools. They're there to train people. I think that they do a good job of saying that, that you go on their site or wherever you go to orientation, they tell you about the job. A CNA, this is what a CNA does, right? Okay, that's, that sounds okay. That sounds fun or whatever, it's, they talk about the job market. There's, there are jobs here. Here's the rate range. Here's where you can work. So I think schools do a really good job of that. Um, I think that it's the people part of it, right? You get out and they go into the work environment. And it's like, oh, I had somebody this year. It's like, oh, I didn't know I had to touch people. It's like, oh, yeah,
I'm
what
going into nursing and I'm not going to touch. I'm going to take
yeah,
a
so that was
stick to
fine. We
poke
got
them.
him in person. We were like, okay, then maybe front office. Like, there's, you can check people in. Let's look for, like,
Let's start for
patient
that.
technician. That might be a better thing for you. So I think it's, I think they do a good job of that. I think you can always bring it more to life. Again, in our Talent Growth Hub, we're looking to have a day in the life, right? Doing videos with people who are in the job to say, like, day in the life. Here's, what are the most challenging things in this job? What are the better things? And then to, what's it like to work in a community clinic versus a hospital? Oftentimes people think about their experience of going into a hospital and some nurse that had a crown on and was so wonderful, they think that I'm going to be that. They don't realize the trajectory of how do you get to be that level in work. So I don't think it's the schools. I think, and it's peopling. If you're, if the average age is, 22 years old, and I've been kicking around working in the mall and doing different things, and now I'm really serious about getting a career. The courses are shorter, So at times, it's not a huge investment to go to school for many of these skill sets. They go out and it's like, there was a guy last year. He went through and he really nice guy. He called me on the phone. I've been looking for a job and I haven't found one. And I said, well, do you tell me about that experience? He told me about the places, and I said, well, there's this, there's that. And he goes, I really want to go back to truck driving. I was a truck driver. I did this because my mom's up my tail and she really wants me to do this job. But, and eventually, I had to have a conversation with mom to say, yeah, it, truck driving is not bad either.
Yeah,
It's what he
he's
wants to
making
do.
money.
I can keep putting him in jobs, but if he doesn't show up because he doesn't like it, that's not the career for him.
And how's the disruption of AI and technology affecting these fields in this industry?
I I'm a huge fan. I think AI is, um, the term disruption is an interesting way to put it. I just think it gives you so much more. If we're looking at anything we're creating, our first place is to go to AI and look at how can we do this better, faster, smarter. I think we encourage our students to use it for just doing research on anything. Really, really, it's absolutely phenomenally amazing.
So typically, we look at AI, using AI internally within an organization, right? Which is yours, right? You're looking at it internally.
Yeah,
How does that facilitate our community management? How does it give us insights into what's going on, so we can make better decisions? And then there's AI that's more geared towards your talent. That, hey, maybe there's certain basic AI related courses that I should be doing as somebody looking for a job. That'll give me a better edge than someone who doesn't know that AI.
that's right.
But what I'm curious about is, typically, no matter how much as a talent you learn and you try to understand AI, are you seeing change from the providers when those requirements come in and they're like, listen, you know what? A year ago, 2 years ago, we were fine with XYZ and this was a requirement. But now this AI component is showing up, or it's not there yet given the segment that you're dealing
We have seen it in the more administrative roles. AI showing up. We've seen it in finance roles. AI showing up. We've seen it in HR roles. Um, Patient care, not so much.
with.
Um,
And that makes
Thankfully,
total.
God, right? I mean, you've got that piece of it, but for any of the, coding, I mean, that's enormous in a hospital, and that's your billing department. And for the coding,
Yeah.
it's like IT coding, right? Does anybody really hire giant engineering teams anymore?
No, you don't. And then you're absolutely right. I think areas where AI has been successful so far, administration, data analysis inside,
Yeah,
recruiting. That's where another ways where AI uses
really great.
is where
To a
you
degree.
need
To a degree.
to a degree, to a certain degree. We have voice AI. It does work for certain positions at a certain
It
level,
does.
you know, and then for the really more sophisticated ones, it really doesn't. So it's kind of a mixed bag
Yeah.
depending on what
We
it is.
use it in recruiting,
Mhm.
but we still have a human in the loop. We always do. And
Absolutely,
that's the
absolutely.
most important piece to me of AI is you have to have a human in the loop who actually knows whatever it is they're doing and can use discretion, and you don't just take it at face value. Oh good, this is what this tool told me, I'm going to do it. That doesn't work.
Yeah, that's what we say, right? It's not about AI replacing humans. It's to replace individuals who don't understand AI or don't use AI at their
It's an
jobs.
enhancement.
Right. That's exactly what it is, and especially for talent coming in, you've got to know certain aspect of it. You just
Yeah,
that's
it's like
that's.
Like
It's coming.
lifting mental weights for for your brain. You want to make your body better, you go out and you lift weights and you do these things. If you want your brain, use AI to help, hoist it up. You look better.
That is true.
It's funny we spoke about radiologies, right? The radiology technicians. Somehow that was the first segment that AI is replacing, already has replaced quite a bit of it, because the accuracy of those, how AI determines going through those X-ray charts accuracy is
Yeah.
just so
Oh,
significantly
yeah.
higher. But yet, at a tech level, where a human being is involved, and you've got to guide the human being on, the patient on how to take those, X-rays. That's where the highest demand is, right?
Yeah.
Versus at a higher level, where
True.
radiology is actually reviewing the analytics part, is where it's eroding actually the
Yeah.
demand. So it's
That's
interesting.
interesting to think about, right? But that is absolutely it. The human in that, the end result is as good as the human on the
Correct.
front end of it.
Correct. It's just so your bottleneck will always remain that human aspect of it
Yeah.
in terms of scale.
But like
Interesting.
everything else, it'll grow, it'll go through iterations, it'll
Yeah.
go through ups and downs, but it is real. I was just at Modex that this was for distribution and warehousing. This is the automation show, one of the
Yeah.
largest ones I've been to, and boy, have I been to enough shows. It was shocking to me what machines could do now in picking and packing, and it's really going to impact the light industrial work big time. It is stuff that you and I back in the day, we've been at staffing since 1995, right? At least me and TJ, we know staffing since then. And you always knew that anybody who did assembly, who did this, who did that, you could put a lot of talent in there. Even today, a lot of places where picking and packing is required, small pieces, requires temporary help, requires contingent labor. I saw stuff that can be done by these robots at a level, at an accuracy that was
Yeah.
scary.
Yeah.
And I came out of there going, we all are talking about the white collar and the administrative jobs that are going to go with AI. But we truly believe that what automation is going to do at the level where someone doesn't really need to use much of brain power, but just know they follow instructions, is going to be even more bigger than that. And that's going to be a tsunami that's going to hit us from underground so fast
Yeah.
that we won't even realize, because these big warehouses are going to convert into that. And the only way it'll affect medical at some point is going to be maybe their machines who can do certain things for
Sure.
certain procedures. But still, I believe that's a great career. I would encourage people to work for organizations like yourself, especially if they want a career where they can be taken through this journey. They can have something to look, you know, a co-op is a great concept. At least there's a family there in a way to belong to. There's some belonging, there's some identity that you can have, and you can go back, and all it requires, old school days, our thing was just don't keep hopping a job, suck it up and do it for a while. Just
Exactly.
suck it up and do it. Whether
Yeah.
it's a year, don't quit till it's done. Medical is a great field, and anybody can keep upskilling and become whatever they want to do, because that's one of the only areas that are probably going to be left where AI is not completely or partly affected it heavily.
Yeah. I think so. I think so. Though, you talk about the robots, so I'm sure there's a future where it looks very different. I hope as human beings, we always want to have some human interaction.
Yes. Uh, but the world will always go through that iteration. We've all
Of course.
seen how we thought, I don't know, what was it, the 2000s, Y2K, look at
Oh,
up and
yeah.
down. This is another huge bubble. It's going to take its time. It will go backwards a little bit after that. Then we'll go
Oh,
forward
yeah.
again. And
The
that's the way
Internet of Things,
we,
you know?
our doorbells are watching us, and and data is being shared. So there will come a time, there will be a drawback. But for the young people that are going out, AI is a tool. Medical is a
Yes.
great field to be in. You can never bet against medical, because humans are going to need humans. They're going to need care as we all are going to get older. that's going to be required. That's just the reality of life.
That's
So,
crazy.
what else could you tell our audience, Melissa, that you would encourage companies? Any messages for the companies? You've been in this industry a long time. Uh, who would be the perfect target? Anything? Go for it. For companies, for talent, whatever you'd like to
Yeah,
share with us.
for healthcare providers, I think that the partnership with AlliedUP Cooperative in our talent incubator model with the pathway to placement for healthcare workers is so important for the communities that they serve. It's really about lifting up the people in your community from a work perspective. It's also about ensuring great patient care. When you have huge turnover, your patients are affected. So we believe that working with Allied Up through our model will help our healthcare providers ensure better patient care while reducing their costs. And in this market, that's really important.
And you're in how many markets?
We can be anywhere. So we work all across the United States. We're small but mighty, but we have healthcare workers: Washington, California, Colorado, Georgia, Mississippi, Arizona. So yeah, we work across the country.
And what would be the best place to find you and the company?
AlliedUp.com. It's probably the easiest way to find us. We've got, like anybody, we've got a button that's like, oh, are you a healthcare provider? Click here. If you're
Both sides of the spectrum would work.
click there. And we get it. We respond. We can't wait to meet with you. I mean, we're excited to bring our model out to the, broader organizations. We're really excited about what we're doing. I think we are making a difference in people's lives, and we're making it different for providers. And I think making sure that we serve both of those communities is really important to us.
And a happy provider gives happy care and keeps the patients happy, keeps everybody happy. So I guess
Yeah.
it's a chain reaction there. So
Yeah, I mean, we all
Melissa,
end up patients one day, so
yes,
selfishly, this is important to me, and it's important to all of us.
sure is. Melissa, thank you so much for taking the time to speak with us.
Oh, thank you, and
Wish you the
Sammy
best.
and TJ, I look forward to connecting because we had some interesting parts of this conversation where I think there's an opportunity for us to have a follow-up discussion.
Uh, we'll get
Absolutely.
in touch with you and we'll go from there.
I
Thank
really
you so
appreciate
much,
it.
Melissa.
Thank you. Have a lovely evening.